Hello, everyone, and welcome to our information session regarding our Masters of Public Health program. My name is Julie Muir, and I am the Graduate Admissions Counselor here at Benedictine. Before we get started, just a few housekeeping notes. The session is being recorded. There is a live transcript available for anyone who would like to use this feature. You can find it in your row of options where the Q&A is listed. And speaking of Q&A, if at any point you have questions for myself or my colleagues about the program, you can write them in the Q&A and I'll be monitoring that throughout the presentation. So depending on the question, we may answer it live or save it for the end. And then here is our agenda for today's session. So we'll go over introductions, have a degree overview, example courses and assignments, future directions, admissions criteria, financing your time at Benedictine University, becoming an Eagle, and then how to stay in contact with us, as well as a Q&A session. And with that, I'm going to go ahead and have my colleagues introduce themselves, and we'll go ahead and start with our program director.
Hi, everyone. I'm Dr.
Georgine, we
Georgine.
can't hear you.
I'm Dr. Georgine Poliak, and I'm the program director for the MPH program here. And I've been with Benedictine University for about 15 years. I previously worked in the public health field as a local health director.
One second. Can you just try talking? There we go. I think I was having technical difficulty on my end. Sorry about that. Love technology.
Julie, Georgine finished. Do you want Krishna?
Perfect. Yes.
Hi, my name is Krishna Bhagat. I have been working at Benedictine full-time for the last 4 years. My background is in behavioral and community health, and I also work with students in a public health student organization. So if you would like to learn more about that, I'd be happy to chat.
And then Mary.
Hi everyone. I'm Mary Spengler. I'm the program coordinator. I've been with the university for 3 years, a little over 3 years, and I work primarily with students to help with advising and curriculum management. And I also work with faculty on helping to support them in their classes.
Thank you. And then again, I am Julie Muir. I am the Graduate Admissions Counselor here at Benedictine, and I'm here to support you through your entire journey here at Benedictine. And so with this, what is public health? And I'll go ahead and toss it up to my colleagues.
So public health means a lot of different things to different people because it's a very broad field. And you can find yourself doing a lot of data analysis, if that's what you are interested in. A lot of people now are interested in epidemiology, which is considered the backbone of public health, where we track down diseases and identify populations at risk. Public health is basically about prevention in populations. So a lot of people might get confused with the medical professions, which is also considered under the large umbrella of public health. But there are a lot of different ways to serve people in the public health field. We're all about solving problems and using that prevention approach and working with groups, entire communities, and populations.
Thank you. And then why a master's in public health?
Well, having reviewed a lot of admission applications, what I find in common among people who want to work in public health is they want to help people, simply want to help people. Some people aren't aware that there are more ways to help people than traditional medical professions. So public health opens up areas for those folks who don't necessarily want to be in direct patient care, although many people in direct patient care also have degrees in public health. Our graduates work in a lot of different settings, from private corporations to local public health departments to international and national health agencies. Our preparation is somewhat unique in that we have people interested in public health who have been undergraduate majors in biology, pre-med, pre-dentistry, business, education, psychology. So we attract people from a wide number of fields who can find their career within public health. In our curriculum, as you'll hear more in detail, we provide both the classroom type experience, as well as having you work with professionals in the public health field in the setting. So when you graduate, you have some real life experience.
Yeah. And then some program highlights.
The outlook for jobs in health in general and in public health, and data analysis, epidemiology, health education are all very positive, especially as the population ages. There will be more need for health programs as our communities change and we see a lot of migration and immigration. We see more diverse communities. Those are all opportunities for people who are working in public health. Our instructors have actual experience in the field that they inform their classes with, so that it's not all theoretical. It's really practical knowledge that you lead the program with. And as I said, you might be working in a local health department setting or in a community clinic, or you might be working for a private corporation, such as tourism industry has actually been hiring a lot of people with MPH degrees who can identify health problems within their population or their customer base. You might work with a wellness program in a retail situation. You might be doing research in a university setting or in a research center. You'll also hear in our curriculum, you can choose your electives based on your particular interests. If your interests tend to lie in one area more than others, you can get specialized courses in the areas of health policy and administration, or health education and promotion, or data analytics or epidemiology, or you can mix from among those courses. A lot of our students are working professionals, and so they appreciate that all of our courses can be taken online.
Thank you. Let's talk about a curriculum overview.
Thank you, Dr. Poliak. So our courses require students to take, or our curriculum requires students to take 14 courses and a total of 43 credit hours. And that's broken up into core courses, which everybody takes, a set of electives that students can choose their own that can be applied towards certificates or just be applied for their own personal enrichment, and then 2 capstone courses. And the capstone courses are generally taken at the end once you've completed all of your core courses and your elective courses. The core courses are foundational so that everybody leaves the program having a very solid understanding of various public health topics such as epidemiology, biostatistics, health education, behavior theory, and understanding basic research methods. And then students who are very interested in specific topics, that's where they can go into their electives and determine, kind of dig deeper into the kinds of courses that they want to take. For instance, students who are interested in health management can select a certain number of classes that specifically focus on various aspects of healthcare management. And the same for epidemiology and data analytics and health education and promotion. And so students, if you want to have kind of a taste of everything, you can choose electives in different areas, and not specifically focus on any one particular area. But if you are very interested in a specific topic, then you can get very, very involved in those activities. And then once you've completed all of your core courses and your electives, you will take the first capstone course, which culminates all of that information. So you'll be expected to draw upon all of the knowledge and skills that you've gained in your previous courses, and apply it in an integrative course that over the span of 8 weeks, you'll be working toward a major project. And then you'll take all of that experience and apply it in a practical setting with your internship. We call that the applied practice experience, and that's generally the last course that you'll take. And then you'll be doing all of your coursework in the field. So you'll be learning from an experienced preceptor and getting hopefully your feet wet in an actual setting, and be able to apply that toward your first job in public health or your next job in public health.
Actually, we do have a question regarding the certificates. Can a student who's a public health degree seeking student, so again, they're working on their master's, can they also pick up these certificates along with their master's degree?
Yes, so that's where the electives come in. If you take anywhere from 2 to 4 specific electives, you can earn a certificate. So all of our certificates require at least 1 core course and then up to 4 electives. So a student can use some of their 5 electives to get 1 or 2 certificates.
Great, thank you so much. Okay, so let's talk about some example courses and assignments.
The health systems law and policy courses is one that I teach, and health policy is kind of my special area of interest. We learn about the political process in the United States primarily, and we learn to understand laws in different states and learn to navigate not just the health system, but also the political system. So an example assignment there that we have used is about involuntary commitment for substance abuse. And students in that assignment are asked to use a tool that's called legal epidemiology, which basically means looking at doing a survey of different states to see what kind of laws they have around involuntary commitments. And then the students work together as a group, and there's a fair amount of group work within the MPH program. So you get to know your fellow students as well. And so out of this group system through which people communicate often through email or Google or other kinds of apps, they come together with a coherent presentation that represents the ideas of the group. And I've had a lot of students say that they weren't really interested in policy or politics, but when it gets applied to the health issues that they're really interested in, like maternal and child health or HIV or COVID, that it really comes to life, and they enjoy that aspect of the program.
Thank you. And then our health behavior theory course.
So health behavior theory is another one of our core classes that all of our MPH students take. Basically, in this course, we discuss theoretical models that can be used in planning a health intervention or understanding why people behave the way they behave about a certain health issue. And so in this class, we do some different assignments that are meant to translate the theory to practice. So for example, in the final project, students have the chance to design an actual animated video intended for a certain target population to encourage a specific health behavior. So students do a fantastic job with this. Many go on to even create their own series of videos to post on their blog or even to share with their colleagues at their place of employment. So whenever possible, even within courses, we really try to make sure we're translating the classroom sort of concepts, theoretical concepts into practice, where students can see the real world implications.
Thank you. And then let's talk about the internship experience.
Sure. So as Mary mentioned earlier, all of our students complete a public health internship towards the end of their tenure here. And again, the biggest reason for that is to be able to apply the skills that they're picking up in the classroom towards actual public health organizations or clinical settings, research, and a whole variety of different areas in which public health can be applied. And we have faculty members in the department from all sorts of different backgrounds, including epidemiology, health policy, health behavior. And so we're always happy to talk to students about their interests and how they might align with certain internship opportunities. We also keep a database of where all of our students have done internships in the past and which preceptors are open to taking on new interns. And so in that way, students also have support in finding an internship that aligns with their professional interests. The picture that you see here is actually from Tanzania, and we have not been able to travel with students globally in the last few years, mainly because of the pandemic, but it is something that students have been able to do, and we hope to do again in the future. Yeah, so there's many local, regional, and even global internship opportunities. Students do all sorts of different practical experiences, and we're happy to support students in finding something that that is the best fit for them.
And then we actually have a question in the chat regarding the internship. How are students placed in the internship, or is it the student's responsibility to find their own?
Right. Yeah. So I did see that question. So as I alluded to, students are not placed in an internship. We really try to encourage students to seek an internship that aligns with their interests. So the faculty and staff in the department are here to support students, provide some ideas as well as a database of where students have done internships in the past. We also all have, local and regional community partners that we work on projects with that are often looking for interns. So we do our best to try to support students, let them know about, available opportunities, but students are not placed in an internship. They get to decide where they would like to complete it.
Thank you. And then where are some of our alumni now?
I can talk about that. They're all over. So as I mentioned earlier, local health departments, hospital systems, clinics, community health centers, free clinics, social service agencies, emergency management agencies, some research institutes. We have graduates who are working for Walgreens, for Walmart, for sports organizations, other private nonprofit organizations. And increasingly, I'm seeing students graduate with the idea of doing small startups in the health and social service area. There are lots of options if you like to work with numbers and computers. Data analysis is a really hot area at this time. Working for an epidemiological unit within a work setting or within a hospital setting. We have graduates who are working for the CDC and a number of different federal agencies. So really, public health is a very universal type skill set that our graduates leave with.
Yeah. And then sort of with that, so let's say you've heard all this information and you want to go ahead and apply. Our admissions requirements, first off, there's no GRE, there's no prerequisites needed. Any student who has completed undergraduate bachelor's degree, doesn't matter what major it is, can come into this degree program. The only things that we require are a goal statement, which is basically, where do you see yourself going forward with this Master's in Public Health degree, a current resume, 2 letters of reference, and your official transcripts. And like I said, a bachelor's degree is required. The program can be completed in 2 years full-time, or you can go at your own pace and take classes part-time up to 6 years. We do have a spring term coming up, as well as summer and then fall. What's very unique about this program is during our fall and spring terms, we have like spring term A, spring term B. And so because the courses are 8-week courses, so you can even start in that halfway point as well for spring 2023, and then also fall 2023 as well. And again, as was mentioned, the courses are available online, and they're about 43 units. And then some financial options, so how to fund your degree. We encourage students, if you need to, get student loans, but definitely apply through FAFSA to get them. Benedictine University also does offer interest-free payment plans, and then you also want to reach out to your employer, as they may either offer employee discounts or employer reimbursements. So if you are currently employed, and especially a lot of our students who are currently working full-time may already work for a nonprofit. And so some of the scholarships that we do offer nonprofit and government agency employee scholarships, as well as military scholarships. And then we have a great alumni scholarship. That one is 25% off tuition discount for our Benedictine University alumni to get that scholarship as well. And then becoming an Eagle. So when you join Benedictine University, you get individualized advising. You work with your faculty advisor, who really becomes a source of resource and support for you. And they're there to answer any questions that you may have. We also have an academic support center, an alumni network of events that we offer throughout the year, as well as an office of career and professional development. They're great resource to have for our current students as well as alumni. Just this past week, I said they were offering free headshots to our current students. They do mock interviews as well as help students work on their resumes. Then also something that's unique to our public health department is they have a public health student organization. So would one of you like to speak about this organization?
Sure, I'd be happy to talk a little bit more about it. So yeah, our public health student organization is a robust group of students that are located all over the country. We're fortunate to be able to coordinate and do the work that they do even in remote platforms. So there's a few goals of the student organization. First and foremost, the organization is meant to benefit the students that participate in it, from networking opportunities, learning about possible careers, just getting to know more about what folks in the field are doing in public health. So some of the activities that we do through the organization include a monthly workshop series in which students benefit from hearing from professionals in the field or even across the university campus on topics such as statistical analysis or doing a more efficient literature review or talking about how to address implicit bias or prejudice or racism in their own personal professional spaces. So these are student designed and student led workshops, and they often invite a professional to weigh in on some of these things. We also have working on your resume or drafting a cover letter, how to make yourself marketable for a public health job. So these are types of events the students host for the entire student body. We also have an annual public health conference, and there's a different theme every year in which students are presenting about their own research or their own work in the professional spaces. They're also inviting faculty members and professionals in the field to speak on certain topics in a very sort of relevant, practical way. And one of the other platforms that we want to build this year is a strong alumni network of people working already in the public health field who have graduated from our program, master's students who are currently pursuing an MPH, as well as even potentially undergraduate students who are interested in public health as a possible career. So these are just some of the things that the students are working on. The opportunities and the options are kind of limitless. It's really whatever benefits the students, they're able to make their ideas come to fruition with the support of some faculty members and staff. So we encourage you to get involved, and if you'd like to learn more, I'd be happy to answer some questions.
Thank you. And then we definitely want you to stay in contact with us. So that QR code is big enough so you can scan it and schedule in an admissions counseling appointment with me. I'm, like I said, your graduate admissions counselor. There's my email address and my phone number. When you schedule an appointment, I would be happy, I would be happy to meet with you, give you a campus tour, and then that link also will show you future graduate events as well as upcoming webinars that we are hosting. And we just look forward to staying in contact with you as you become an Eagle and hopefully complete your MPH here at Benedictine University. And with that, I don't see any other questions in the chat, so we're going to go ahead and wrap this up. Are there any final thoughts that you want to share before we close the session? No? Okay, great. So I want to thank my colleagues for joining us today. And we're going to go ahead and end the session now. Thank you, everyone.
Thank you.